I'm Miles Hassel. I'm the founding physician of the Comprehensive Risk Reduction Clinic in Portland, Oregon. I've been practicing evidence-based lifestyle medicine as well as conventional internal medicine and diagnostics for over 25 years, and I'm the co-author of the lifestyle guide, Good Food, Great Medicine, and I'm a medical educator for medical students and medical residents. Our team here would like to see the facts concerning lifestyle medicine to be easily available to other physicians, nurses, dietitians, and patients everywhere. We are building an educational foundation that will offer an evidence-based lifestyle medicine tools using a free website that should be available to everyone. This video will describe some of the kinds of stories, some of the kinds of patient successes that have motivated us to launch this educational foundation. Now, lifestyle medicine is just one component of conventional medicine, along with pharmacotherapy and surgery and so on. However, for most people, lifestyle medicine is the most important component, the earliest component, and arguably inadequately emphasized. There's a critical importance in appreciating the impact of evidence-based lifestyle medicine options. For example, in the Nurses' Health Study, which was a very large study that's gone on for 25 or 30 years, they found that about 80% of heart disease and stroke, about 90% of diabetes, about 60% of all cancers seems to be able to be prevented with a simple basket of lifestyle tools. Now, the other diseases that are also responsive to lifestyle medicine is huge. Autoimmune disease, cancer survivorship, anxiety and depression, the various forms of arthritis, neurodegenerative diseases such as Parkinson's disease. All of these should include lifestyle medicine as part of the preventive medicine or treatment options. So a person might ask, why is lifestyle medicine not more prominent in conventional medical care? One of the reasons probably relates to the fact that both physicians and patients don't have a simple and reliable web-based resource that they can go to that summarizes the available information on what actually works, what doesn't, and what is the real evidence available. The Comprehensive Risk Reduction Foundation is designed to fill that void. In this video, we'll be talking about 5 individual cases that demonstrate the value of lifestyle medicine as a primary treatment modality in addition to being a preventative health tool.
My name is Shelley Johnson, and I have been working in healthcare since 1999. My nursing teams use the lifestyle medicine principles found in Good Food, Great Medicine to reduce the prevalence of gestational diabetes in our Women's Healthcare Institute. We shared a copy of the book with each new pregnant woman who was interested and saw a reduction in gestational diabetes, high blood pressure, birth injury, operative birth, and intensive care needs for newborns. We also saw a reduction in anemia. So all these outcomes happened with all those women who put the book into action. Now, as a nurse at clinic and at the bedside, I always wished there was a free web-based platform with the most up-to-date research on lifestyle medicine to share with my doctors and patients just how well this works. I was invited to join Dr. Hassel's team in 2021 and saw disease reversal over and over again. I was encouraged when Dr. Hassel asked me to help him build this foundation.
We were introduced to lifestyle medicine. My wife was diagnosed with breast cancer, and we were searching for options. I didn't realize it, but I had high blood pressure and I was pre-diabetic. So through lifestyle medicine, I was able to reduce my blood pressure top number from 200 to immediately within the first month to about 175. And then within a year, I was hovering around 135 to 140. So not only did my blood pressure go down, as my blood pressure numbers went down, so did what I call the LBs, the pounds went down. Ultimately, approximately 30 pounds came with those 65 points on my blood pressure. I would recommend lifestyle medicine to others. Anybody who will listen. And I tell them just to try it. That's what we said. Hey, we're going to try this. What's the worst thing that could happen? Nothing. What's the best thing that can happen? It can change your life.
Is your high blood pressure being treated optimally? So what Elias asked when he first found he had high blood pressure and so on is about the side effects and the alternatives to blood pressure drugs. He understood how serious high blood pressure was, that it can cause brain damage, increased stroke risk, heart damage, heart failure, kidney injury, and lots of other bad things. So blood pressure drugs are a whole lot better than doing nothing. But the majority of cases of high blood pressure respond very well to simple lifestyle measures such as specific dietary changes, activity levels, and waistline control. What this means is that these patients can often be treated without high blood pressure drugs. Blood pressure drugs make sense for many people, but not for everyone. Blood pressure medicines can often have side effects that the patients don't like very much, and they typically, in most studies, do not reduce the risk of stroke to the same level as someone who does not need blood pressure medications. So lifestyle choices can both replace high blood pressure medications in some people, or simply reduce the doses or the amounts of blood pressure medications that are required to achieve a target blood pressure. And the same lifestyle steps that improve blood pressure also have a broad range of other metabolic benefits and improve well-being.
The lifestyle medicine really helped me in my treatment as I was going through breast cancer. It really gave me a sense of that I was going to get through this because I felt better. As I was walking, as I was eating better, it just gave me the idea that I was taking care of myself, and that gave me hope.
Breast cancer is a worrisome diagnosis to face and common enough that many of us have been touched by it. Monica wished for some strategies that would be cultivating hope, improving her outcomes, reducing risk of breast cancer recurrence, and reduce side effects from the cancer therapies that she was undergoing. So evidence-based lifestyle medicine didn't replace conventional therapies for breast cancer, but added to it, because a healthy diet and physical activity can lower the risk of cancers, lower cancer recurrence, lower side effects from conventional therapies, and this even applies to genetically determined cancers. As a good side effect, then these choices also have benefits that go far beyond reducing the cancer risk itself. Less depression, less heart disease and stroke, less diabetes, less dementia, and better overall well-being.
I heard about evidence-based lifestyle medicine through reading the book Good Food, Good Medicine. And then as I got older and started to get some blood work results that I didn't like, and I needed to make some changes, I went to my PCP and he said, oh, here's a whole bunch of medicine and let's go speak to a pharmacist and let's do this and do that. And I did not want to do that. It didn't feel like the right road for me. And so that's when I reached back and reached out looking for some other answers. Through evidence-based lifestyle medicine, I was able to reverse diabetes. I had an HbA1c of 10.7. It's been down at 5.5 for well over 2 years. There were no pharmaceuticals needed. I didn't take any medication throughout the process, before, during, or after. I haven't needed them, and I feel great.
When Stephanie was told she had gestational diabetes, she had a clue that something in her lifestyle should change. What she wasn't told was that 50% of women with gestational diabetes go on to develop type 2 diabetes. Stephanie hoped that after her baby was born, her body would behave, but it was responding to the lifestyle she was living. Stephanie took a few evidence-based lifestyle steps to reverse her diabetes years ago. Today, she's still testing with a normal hemoglobin A1c, and she reversed the evidence of diabetic kidney injury.
Congestive heart failure is an unfortunately common condition. Maybe 6 million adults have this right now in the United States, and it's really a leading cause of death. It can be devastating, debilitating, and it seems to be associated with things like coronary artery disease, where the arteries get plugged with atherosclerotic change, high blood pressure, type 2 diabetes, and other things. Conventional medicine treats this much better now than we were 20 or 30 years ago, but it still causes significant reduction in quality of life and often premature death. For the majority of cases, the treatment involves treating the underlying cause as well as treating specific changes that occur with congestive heart failure. However, there are some rare causes of congestive heart failure, and this is one of those cases.
Well, I've been pretty active individual in my lifetime, starting with lettering and gymnastics in high school, 4 years in the United States Air Force, avid mountain climber, peaks 10,000 to 14,000 foot range. And when I was about 75, the illness came on very suddenly and aggressive with needing hospice at home and oxygen, and I couldn't really function properly. I literally knew I was dying. I had extensive medical studies done by cardiologists and pulmonologists, and all they knew is I had a weak heart and had congestive heart failure. The comprehensive risks, they did a test and found that I was deficient in B1, which is thiamine. 7 years later now, I'm after being on hospice and near death, I've recovered and I'm here and working on the farm.
Again, there are many causes of congestive heart failure, and many cases can be prevented with good lifestyle choices. For example, if you reverse type 2 diabetes, we would think that you were going to reverse the congestive heart failure that we often see with type 2 diabetes. Other cases respond to the many conventional medical approaches that we have available. Certainly, there's a strong role for conventional medicine here. But in cases such as Mike's, it is important that we don't give up too easily. We have to leave no stone unturned in the search for cause of illness, even if that means we look for some really rare stones. The cause of his congestive heart failure, thiamine deficiency, has been recognized for over a century, but it's very rare. But it's also very treatable, and the treatment, as you can see, is very life-changing.
So I was struggling with depression and despair and kind of had come to an impasse. And so my therapist was like, I think we need to consider meds. And didn't want to do that, but I'm like, I'll try anything. Steered me away from wanting to go with meds was several friends that I've had that have gone on them or are on them. They've just seemed more like almost, they don't have highs or lows in life. And even though it sort of has helped them, that's not what I wanted. I didn't want to be without my highs and lows in life. Besides meds, there was also this evidence-based lifestyle medicine. Definitely had the evidence there. I'm like, I like evidence, I like facts. So I thought, let's try that. Even though it might be kind of hard to dial in your nutrition a little bit more, it's changed. It's been a game changer. The down days are less. I don't have the despair that I used to have. I'll never go back to eating the way that I was eating before. For anyone that's struggling with depression, to try this first, yes, because you feel better and it helps you be in control too of where you're going, what you're doing.
Kim had a variety of very real life events that, although not life-threatening, were creating a deepening depression. At the Comprehensive Risk Reduction Clinic, we talked not only about solutions to lighten her life load, but also the evidence-based lifestyle steps that favorably alter brain chemistry to treat depression. 2 weeks later, she noted that her mood had lifted, the sense of despair was gone, and she did not think she needed antidepressants. Some patients do very well on antidepressants and anxiety medications, but as her doctor discussed with her in reviews of placebo-controlled trials, we appreciate the benefits of them are often modest and side effects can be troublesome. While some patients, like Kim, find that lifestyle acts as a complete treatment for their anxiety or depression, others use evidence-based lifestyle to get better results with the antidepressants or anti-anxiety medications alone.
The bottom line is that we think that there is a critical need for reliable, easily accessed, and truly evidence-based lifestyle medicine information source. Something that tells people what works and what doesn't. If available, it would save lives all over the world, reduce misery, reduce financial burdens, and improve the quality of healthcare everywhere. We would appreciate your critical feedback regarding this idea and your financial support if you agree with us.